We are going to talk about the lacrimal system. So we know the lacrimal gland, which is present in the supero-lateral part of the orbit, and it's actually the gland for secreting tears, tear secretion. The tears is made up of the lipid membrane and then the aqueous membrane and the mucous membrane. Okay, so what happens is via ducts, so we call them as a lacrimal ducts. These just drain, and they drain over the eye, and they form two channels. From the punctum, we have this lacrimal punctum, and through the punctum it forms a cyst called as a lacrimal cyst. And from the lacrimal cyst there arises a naso-lacrimal duct, and finally it drains via the nose. And that's the reason why when a person cries, fluid starts coming out from the nose, just because the tears just enter the nasal cavity via this naso-lacrimal duct. Now what can happen is, like, imagine there can be stone formation in this pathway. So this causes dacryocyst, stones. So this might result in blockage of this channel. In this case, what can happen is it can result to a condition called as Epiphora, in which there is profuse flow of tears from the eyes.